into institutional-based
so we take
environment.
the services
So
to
we have
them.
to take the services to them. So when we're able to do that, you find out that we're able to close a lot of gap that may be a problem.
Now, Dr. Abioye, how does the lack of access to infrastructure affect the rehabilitation process for persons with physical disability?
Lack of access is a very big problem for people with disabilities, because the present infrastructure in the country today is not taking cognizance of disability, because sometimes you just imagine there are no ramps, lifts, and other access-based facilities that can help people living with disabilities to really move around, so that they could even be able to access these care we are talking about. Thankfully to the president of today, who has thought it wise to assent to the bill of
he only has like one day left, so go ahead. That's only lifetime.
People living with disability. It has become an offense for even designers, infrastructural designers, not to incorporate people with disabilities in their design. I learned is about 1 million naira fine for any infrastructural development that is devoid of access to people living with disability. So with time, I believe that this will improve. But when you consider the real access for people living with disability to accessing medical rehabilitation services, most times they are impaired or barriered by the
physical structure.
The structure, to the point that the places where in present design in the hospital today, you see that the physiotherapy department, the location may even be in a place
that should be a thing of concern. Now, I thank God you mentioned that. Now, what's the role of your organization in making sure that, at least let's counter that problem? I mean, it's very specific, yes.
Okay, let me say something. In August 10, 2017 or thereabouts, the Nigeria Society of Physiotherapy, more like the pediatric section, specialty group, took it upon themselves. I think we hosted a program at Bayelsa House in Central Area, and we launched CHIP, that's talking about find a child and provide the necessary intervention program. So CIIP, Child Find Intervention Program. Then we also launched the CAAD, that is Care and Integration for Adults and Adolescents Living with Disability. And we talked about some of all those challenges. It's just like Dr. Ayo said earlier, it's recently we're beginning to see special parks for disabled people. And these days, you even see people park their cars even when they are not disabled. And he talked about the fine, as a result of the disability bill that was recently signed. But we need to take it a lot more serious, because in everything that happens, there should be a need for political will, collaborating with the professional bodies. Okay, now we physiotherapists in Nigeria, we have a program that we are seeking to use to close the gap because of the number of children with cerebral palsy we see, because of course that's a major physical disability issue that we have around us. So if we thought it wise to do that, and also putting it to the government to look at it as our own side of the story, to help and make it a lot more easier for us. And when it comes to the medical model, all we do, it's dependent on the level of training that we get. We know these things.
But do you need any level of training that a hospital, for instance, that have maybe few physiotherapists now,
Yes.
for instance, there is no access to, like the physical structure is not even accessible. Is that something that should be appalling right now?
Yes, that's
like,
a challenge actually. But it's not even only in the hospitals, it's everywhere. of course, walking into the building to this place, you could find that okay, there is a ramp on one side, and I know there are some buildings you walk in, they just put like wood, it's temporal, so people don't want. But in the hospitals, of course, the architects and the structural engineers, binding from what the law says, and disabled people also coming out to say, we have a right, we need to be included, because organizing telling us to come to an environment that doesn't even speak or appeal to us, because will I come good? So you are discriminating against us without even saying it. So whenever a new building is constructed in the hospital, I think by the intervention of different professional bodies and of course the medical community understanding that this is a big problem, even though not because of the bill, but you know that you need these people to come into your facility as patients. So a whole lot has gone, and I think a whole lot has changed right now. Because the hospital I work in, of course, we've made provisions for ramps, we've made provisions for, access rails for people with challenges in different forms to be able to access our service.
We just hope that every other hospital around the nooks and cranny of this country, Nigeria, take from that example, from your hospital. Well, thanks for staying tuned. It's still Disability Inclusion on Network Service of Radio Nigeria, and we're talking about medical rehabilitation for persons with physical disabilities. We're talking about some policies and initiatives that that we need to address to look at the issues of access to medical rehabilitation. So yeah.
Yes. I was hammering mainly on training and of course recruiting more people.
Okay, so we need policies that will definitely reinforce.
Of course, they will reinforce training of medical professionals, investment in medical rehabilitation and improving so that it can help improve treatment for people living with disability.
Okay, so let's talk about government now and health organizations. What's the collaboration level? What can be done to improve access? Because when we talk about this access, we someone might be thinking of the financial implication now to this. It's one thing to know that you have a problem and you want to fix it, but it's another thing to know that you're incapable because you don't have what it takes, like money now, to be able to help you to gain this access. How do you think governments can collaborate or synergize with health organizations to make sure that probably medical rehabilitation services are being cut down to like almost the lowest level, where anybody with disability can have access to medical services or rehabilitation in every part of the country?
Thank you. We just came out from a program on universal health coverage, where no one should be left behind. That you are disabled, that should not prevent you from having a story that you are living with one form of disabilities, should not prevent you from accessing healthcare. So, and I think the World Health Organization has thought it wise that everybody should be covered in terms of seeking for help.
Sorry, can you explain that in details? When you mean covered, how do you mean?
Okay, there's this policy of the World Health Organization talking about universal health coverage for all. Okay. Where it shouldn't be maybe because you are not having funds or because you are disabled or there should be no challenges to accessing healthcare. So it's one of the goals that which is captured on the SDG, Sustainable Development Goal, where the universal health coverage is on the front burner. So I was trying to just put some light into what the government of the country has done. In the course of my research, I come to terms that it's not that we don't have policies for people living with disability or people with disability, but the major problem is that a lot of ministries, like the Ministry of Women Affairs and Social Development, Ministry of Women Affairs, Ministry of Health, even Ministry of Communication, they all have frameworks, they have a policy on people living with disability. But I think at this point now, these policies have to be unified and domiciled holistically so that it will affect everybody living with disability, and it will also improve the access to rehabilitation care. Of recent, there were trainings on universal health coverage, but one thing I like to say is that in the Sustainable Development Goal, it was not captured. Rehabilitation was omitted. So on that line, the World Health Organization now did a call for action where they now put it as a Rehabilitation 2030, where they try to correct that omission, and they now make it now that rehabilitation is one of the key services that will help to enhance or achieve the universal health coverage. So where they explicitly put out the emphasis and the machineries that they will use to achieve this with the Global Alliance on Rehabilitation, which even the World Congress of Physical Therapy president is the vice chair of that committee globally. So with this, it's become imperative that all ministries of health, both at the states and the local government level, national and state level, should domesticate rehabilitation services in their Ministry of Health, so that everybody will be carried along, and it won't be a barrier for anybody that wants to access medical rehabilitation services.
So, Namdi, do we have some innovative approaches or even technologies that can be used to overcome some of these barriers? Do you think it's something we can come up with, or is it already available now?
Okay, so before I answer your question, I would just like to chip in something.
Okay.
You see, he's just talked about universal health coverage and the need to provide some level of help or health for all. Healthcare is a right. We have to look at it like that. Then when it comes with persons with disability, there is this linkage between disability and poverty. Kind of, I will explain. When someone is disabled or living with some form of physical disability or another, there is, because of what is obtainable, there is some level of exclusion. The person doesn't feel empowered. There are some level of social denial in a few things. Like, you could go to some organizations, you find out that persons with disabilities don't even get a job. It's too competitive, getting admissions and stuff like that. And they end up in the villages doing menial jobs that could barely support their daily life. So these people become so poor, and accessing healthcare becomes a big challenge too, because sometimes you need to pay. So we are also at the forefront of looking at how there can be an insurance policy. Having an insurance, some of us might understand insurance as HMOs. Yes. Providing when you go into the hospital, you don't need to physically pay. But how many disabled people or people with disability have access to that? Now, people with insurance may be people who have jobs.